The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We're approaching our 50th episode here. I believe this is number 48. And so we're looking forward to our 50th podcast anniversary coming up in a couple of weeks here. This podcast probably will be a little shorter than most. And we are taking a bit of a break from what generally dominates the podcast, which, as you know, is Medicare Advantage and issues surrounding Medicare Advantage. Today, I'm sort of going to cover a big issue in the traditional Medicare fee-for-service program. As most people know, there's 60-some million people in Medicare. A little over half of them are in Medicare Advantage, but the other half, roughly, a little bit of minority, I guess, are in the traditional fee-for-service program. Now, as you know, this is a program with no prior authorizations, pretty unfettered access, a lot of waste, fraud, and abuse. So it's not one of my favorite programs. I'm a real believer in Medicare Advantage because I do think it will save the country money over time. And it also brings much better quality than the traditional fee-for-service program. And we've covered a lot of that in the past on these podcasts and in my blogs on healthcarelabyrinth.com. But I did want to cover this major traditional fee-for-service issue because I do really believe it's hurting healthcare overall. And so again, taking a break from health plans and MA to discuss this issue. I don't spend a great deal of time defending physicians, as the vast majority of them are now owned by hospitals or health systems, private equity firms, and health plans. In each of those three cases, I feel like the physicians are employees of these major enterprises, and they may or may not be working in favor of the best healthcare system out there. And today, between those three things, hospitals, health systems, private equity firms, and health plans, about 75% of all of our physicians, whether primary care or specialists, are actually employees, essentially. And we'll discuss a little more about this later. But as the math says, there are about 25% of docs who are still independent and are essentially being run out of business, in my view, by very poor Medicare policy. And this essentially comes about because for the past many decades, these physicians, whether they're primary care or specialists, have not really had a reliable reimbursement system in the Medicare fee-for-service program. They're sort of ugly stepchildren. The hospitals tend to be taken care of. Other facilities tend to be taken care of. But for a whole bunch of different reasons, physicians have never really been taken care of. And that has really, again, run a lot of independent physicians out of business. And it has created some very bad trends in our system. Part of them I've talked about doctors being bought by hospital systems, private equity, and health plans. But the other fallout is essentially independent practices can no longer make it. And part of it is because of the fact that there hasn't been a reliable and reasonable Medicare physician reimbursement system. And more importantly, we have seen an erosion of primary care and things like that. And so there's a lot of, expansive issues impacting the entire healthcare system that result from the lack of a good Medicare fee-for-service reimbursement system. So that is what we'll talk about today, what I call the lack of a reasonable long-term fix to Medicare doc rates. And so we're going to get right into it right now. So Medicare rates are extremely important for a number of reasons for doctors. So while 40 to 50% of the nation has employer or commercial coverage, there are somewhere around 64 million Medicare enrollees. The number of enrollees in Medicaid is actually greater. Medicaid and S-CHIP is about 80 million. So you'd say, Mark, if 40 to 50% are employer or commercial and 80 million are in Medicaid or S-CHIP, why does it really matter what happens to the 64 million Medicare patients who go to doctors? Well, the reality is that Medicare has very, very high utilization, much higher than employer or other commercial coverage or even Medicaid and S-CHIP for the most part. So while there's only about 20% of our country, let's say roughly, that is on Medicare, the very heavy utilization of the seniors and the disabled is very important reimbursement to doctors. So you could sort of line up Medicare physician payments because of the high utilization on roughly 64 million or 20% of the population, together with the employer commercial population that is 40 to 50%. So both of these are very, very critical to doctors' practices and payment streams and things like that. In many ways, Medicare can make or break a practice, and the continual lack of a fair reimbursement system has meant the poor docs have been on a proverbial reimbursement roller coaster for decades now. The ups and downs have undermined independent practices, led to our primary care deficit, and actually fostered physician group acquisitions that increase costs in the healthcare system in a number of ways. We'll talk a little more about that a little later. So here's a little more background. As a word of caution before I give you details on the history of Medicare physician pay, I am by no means a traditional Medicare fee-for-service program rate expert. So I am keeping this short and giving you just a broad overview in the background area here. The long and short of it is that Medicare physicians have had a rather broken rate system dating back to 1992. The bad system has been undermined further with various budget reduction requirements applied to the physician rates along the way. Congress created the Medicare physician fee schedule through the Omnibus Budget Reconciliation Act of 1989. At the time, the fee schedule had three components to calculate rates for physicians each year: a relative value scale, geographic multipliers, and a conversion factor. All this comes together to translate the relative values into fees. The new fee structure was put in place in 1992. The fee schedule calculation was later simplified. From the start, it was pretty clear that primary care was a big loser compared with specialists in the new rate setting system. The rate setting system emphasized paying more for services and surgeries than what is known as evaluation and management, also E&M. Sure, specialists bill under E&M, but it is primary care that is almost exclusively reimbursed under E&M. Thus, the structure essentially undervalued primary care in favor of specialist payments. Then along came the Balanced Budget Act of 1997. The act included what is known as the sustainable growth rate, where all physician payments were limited by a budgetary growth cap, which limited increases and even mandated reductions in certain years depending on growth overall in Medicare physician expenditures. The SGR had numerous flaws. In fact, it further pitted specialists against primary care physicians. Some of these flaws were fixed in 1997. The SGR was eventually repealed in 2015 as part of the Medicare Access and CHIP Reauthorization Act, or MACRA, but caused great damage for many years to physicians and their practices. In addition, there have been other budgetary sequester measures to restrain spending and lower deficits or debt. that have further limited physician rates by forcing reductions over the years. With the SGR repeal, MACRA introduced value-based incentive payments as part of Medicare physician reimbursement. Other provisions have been passed as well. These quality incentive payment programs include accountable care organizations or ACOs, the Merit-Based Incentive Payment System or MIPS, and other alternative payment schemes that appear to be value-based reimbursement. But these programs can lead to both reductions and rewards based on performance. Providers have great costs to meet the requirements of these programs. And in the case of MIPS, the program is budget neutral. There are annual winners and losers. So, what has all this meant to physicians over the years? Well, due to the poor fee schedule, the SGR, and budgetary sequesters, Medicare docs have been hit very hard. In real terms, physician fees have actually gone down and not kept up with healthcare inflation. Some argue the real drop in the fees is about 26% from 2001 to 2023. Well, with the introduction and that background, we'll take our first break and we'll come back to talk a little more about the roller coaster that Medicare physicians have been on.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Medicare physician fees and the roller coaster that physicians have been on for a number of decades now. So, as I said, the roller coaster ride for physicians in terms of physician fees really continues to this day. While the SGR is gone, and that created some of the biggest problems, Congress still has refused to really fix the physician fee formula due to its sheer cost. In fact, lawmakers have led physicians through a political game over the years. To stop the huge reductions in fees that would occur regardless of the SGR, Congress passes what's known as stopgap measures, which temporarily overrule mandatory reductions in whole or in part in the physician fees. But physicians can actually wait weeks, months, or more to see these temporary overrides come through from Congress. Congress has eventually given temporary relief from reductions and some temporary increases more than 20 times over a number of decades. In some years, SGR would have enacted devastating cliffs of 20% to 30% reductions in the fee schedule without the temporary retrieves. With the SGR gone, those major cliffs have gone away, but the permanent fix to the formula itself has proven elusive, and physicians continue to face reductions before temporary measures are put in place by Congress. Imagine trying to run a business under these circumstances. There have been some primary care relief. A Medicare rule in 2020 did offer some relief for the primary care docs. The rule increased payments to primary care by boosting the overall value of office visit E&M codes by an estimated 12% and adding in various new reimbursement and add-on codes to facilitate upfront care management. But this change does not fundamentally change the underfunding and roller coaster Medicare docs are on. In terms of budget neutrality, the law continues to require that any changes to the Medicare physician fee schedule be budget neutral. Increases in payments for any specific codes must be offset by reductions in others. This creates, again, the competition between primary care and specialists, which is very, very unhealthy. With that, we're going to take our second break here to tell you a little more about what actually happened to doc practices, as I alluded to in the opening. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast on the Medicare Fee-for-Service Doc Rate Challenge. So what has happened to docs over the years because of this Medicare Fee-for-Service payment problem? Well, there is little evidence of physicians bowing out of Medicare Fee-for-Service. However, the remaining independent physicians are now saying this could become a reality. Actually, what's happened is something much more sinister. Doctors did not give up on the Medicare program, but actually gave up on their practices instead, as I spoke about in the introduction. As the ongoing fee schedule issues grew, more and more independent physicians left the ranks of independent entrepreneurs in favor of becoming employees of hospitals and health systems, health plans, and private equity firms. Admittedly, fees were just one reason for this trend, but a very important one. The rate issues meant independent practices became a difficult financial proposition, were an administrative headache, and caused physician burnout. What lawmakers miss in the debate over a permanent fix for Medicare doc rates is that the program is likely paying more now than if Congresspeople had funded primary care and physician payments reasonably. If they had, fewer independent practices may have folded. When hospitals and health systems got their hands on doctors, the costs of physician services shot up, as the docs were now part of an expensive hospital entity. Hospitals also demanded their new employees change their practice patterns to treat at more expensive hospital-owned facilities. I would note, too, that the decades of poor physician fee schedules in Medicare have led to the erosion of primary care in the nation. What is happening for federal fiscal year 2025? No surprise, but Medicare docs saw yet another rate cut for FFY 2025, which began October 1. The reduction is 2.9% for 2025, after a 1.7% cut in federal fiscal year 2024. This is just as inflation is reemerging in the healthcare sector. Again, lawmakers are talking only about a temporary reprieve, rolling back some or all of the change in the 2.9% reduction, but they are right now not talking about a permanent fix. With that, we'll take our third break, and we'll be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back from our final break. We hope you're enjoying this episode of the Healthcare Labyrinth podcast covering Medicare physician rate issues. So I'm going to sort of just conclude here about what Congress should do. Lawmakers in Congress should work on a bipartisan basis to fix the mess they have created and have allowed to fester for several decades now. End the roller coaster ride for physicians. Fees should be reasonable moving forward and grow with inflation. Congress should also move to further reimburse primary care in an effort to convert the healthcare system to care management, wellness, and prevention. Medicare Advantage is migrating to per-patient payments for assigned panels. This is helping control costs, drive quality, and increase physician reimbursement. While a pure capitation model would be harder in the fee-for-service program, given a lack of primary care physician assignment, a hybrid approach of services payments and per-patient reimbursement could occur and should occur. A permanent and fair fix will cost money, but as I've already indicated, we're probably spending more money now because we didn't have a very good reimbursement system for doctors over the years. Congress should offset some of the costs by implementing site-neutral payments in the healthcare system over the objection of the hospital lobbies. This would stop further physician practice purchases and reduce overpayments at hospital-owned sites. Site-neutral payment implementation in full could save $145 billion over 10 years in Medicare. Some estimates say $471 billion over 10 years could be saved via full site-neutral payments throughout the system. This would come in Medicare outlay savings, Medicare out-of-pocket costs, and in lower commercial costs. Some say the estimates of savings in the commercial world are even higher. See my previous blogs on how hospitals could economize and make a profit, as well as on site-neutral payment reform at the blog tab of healthcarelabyrinth.com. Docs deserve better, especially as we enter the looming healthcare staff shortage. What message are we sending in our treatment of physicians, especially those in primary care? Studies show other developed countries spend more than double what the U.S. does on primary care, and that investment leads to lower cost and better outcomes. When will lawmakers get a backbone and prioritize this crisis? The time has come for a real fix to Medicare physician fees. The big stall is hurting healthcare overall. With that, we'll end this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.